Welcome to the module. Today we will cover Autism Spectrum Disorder, ASD. Let's begin. Introduction to the module. Autism Spectrum Disorder, ASD, affects communication, behavior, and social interaction. Understanding ASD is key to fostering inclusivity. This module covers clinical features, causes, and controversies, such as the debunked link between autism and vaccines. Learning objectives. At the end of this module, you will be able to identify the core clinical features of autism spectrum disorder, explore the developmental aspects of ASD and its impact on individuals, understand the multifaceted causes and risk factors associated with ASD, examine the scientific consensus on the relationship between autism and vaccines. Introduction to autism. Autism spectrum disorder, ASD, affects communication and interaction with the world. Diagnosed in childhood and permanent, it becomes part of one's identity. With proper support, individuals with autism can lead fulfilling lives. Prevalence of autism. Approximately 1% of the population has an autistic spectrum condition, with a higher prevalence in males, 2%, than females, 0.3%. This disparity arises partly because females mask their symptoms more effectively. Autism is viewed as an intrinsic part of personality, with prevalence rates varying yearly due to diagnostic and awareness changes. Long-term symptoms of ASD. ASD has two primary long-term symptoms: repetitive and restrictive behaviors and communication issues. Individuals may also have varying sensitivities to touch, color, light, and sound. Some prefer the term autism spectrum condition to highlight the cognitive benefits alongside the disabilities. Types of autism. Autism can be broken down into several different diagnoses, including Asperger's syndrome, autistic disorder, Kanner's syndrome, childhood autism, atypical autism, pervasive development disorder. Not otherwise specified, PDD-NOS. Correct autism terminology. The term autism spectrum reflects the varying severity of autism symptoms, highlighting the uniqueness of each individual's experience. Clinically, ASD is now used instead of autistic disorder, Asperger disorder, and PDD-NOS. Educators must use correct autism terminology. Clinical features of ASD development. Social communication and interaction are challenging for people with ASD. They often struggle to fit in and/or have a hard time communicating with others. These challenges can manifest in various different ways. Social communication behaviors. People with ASD often show social communication behaviors such as making little or no eye contact, not looking at or listening to others, rarely sharing enjoyment, and responding slowly or not at all to their name or other verbal cues. Social interaction behaviors. People with ASD often struggle with conversational back and forth, frequently discussing favorite topics without noticing others' disinterest. They may use facial expressions, actions, and gestures that don't match their words, have unusual voice tones, and find it difficult to understand others' perspectives or predict actions. Restrictive or repetitive behaviors. People with ASD often exhibit repetitive behaviors like echolalia, a fascination with specific subjects and narrow interests. They may become irritated by minor routine changes and have varying sensitivities to sensory inputs like light, noise, clothing, or temperature. Upside of having ASD. People with ASD may excel in various areas, such as retaining information for long periods and having strong visual and auditory learning abilities. They often perform well in maths, science, music, or the arts. Causes and risk factors. While this is not always the case, however, there are many factors, including environmental, biological, and genetic factors, that may increase a child's risk of developing an ASD. ASD vulnerability insights. Most scientists agree that genetics increase the likelihood of developing ASD, with children having ASD siblings at higher risk. Certain genetic disorders, medications during pregnancy, and older parental age also elevate ASD risk. The key period for ASD development is before, during, and immediately after birth. Autism and vaccines. Despite misconceptions, studies have debunked any link between childhood vaccinations and ASD. As an educational professional, it's essential to be well informed to effectively educate others and dispel unfounded concerns. With a few exceptions, vaccines administered to children and adults are very safe, according to an Institute of Medicine (IOM) assessment published in 2011. Antigens and autism. A 2013 CDC study confirmed that vaccinations do not cause ASD. Researchers found that children with and without ASD received the same total quantity of antigens from immunizations, proving that vaccine components do not trigger autism. Thimerosal, no link. Research shows that thimerosal, a mercury-based vaccine preservative, does not cause ASD. The IOM's 2004 study and 9 CDC-funded studies since 2003 found no link between thimerosal-containing vaccines, the MMR vaccine, and ASD. Further precautions. Except for some flu vaccines, thimerosal was withdrawn or lowered to trace quantities in all pediatric vaccines between 1999 and 2001. This was done as part of a larger national effort to decrease all types of mercury exposure in children before research proved that thimerosal was not dangerous. As a precaution, it was done. Highlights from the module. This module covers the following points. Autism is a disability that impacts an individual's communication skills, how they interact with other people and the world around them. The phrase autism spectrum represents the fact that the symptoms of autism can vary from very severe to very mild. Many factors, including environmental, biological, and genetic factors, may increase a child's risk of developing an ASD. Based on the available epidemiological data, there is no evidence of a link between the measles, mumps, and rubella vaccine and ASD. The chemicals in vaccines do not cause autism. You have now completed this module. You can study the module again and take notes where necessary. Next, we will request that you attempt the exam to check how much you have learned from this module. Hi there. This module is about learning disabilities of children with autism. Let's get started. Introduction to the module. Understanding learning disabilities is crucial for educators, especially for students with autism, to create an inclusive learning environment. This module explores autism's impact on learning and provides practical teaching strategies for optimal student engagement. Learning objectives. At the end of this module, you will be able to identify sensory challenges affecting autism-related learning, address executive function deficits in autistic students, adapt teaching for cognitive processing differences, tailor lessons to the learning preferences of autistic students, implement strategies for handling repetitive behaviors. Impact of autism on learning. Research from the CDC indicates that 60 to 70% of individuals with autism also experience learning disabilities, with reading disabilities being the most common. A thorough understanding of these factors is essential for helping children with autism succeed academically. Sensory processing differences. Sensory processing refers to how individuals perceive and respond to environmental stimuli like sounds or visual input. Children with autism may show hypersensitivity, increased sensitivity causing distractions. Hyposensitivity, reduced awareness leading to issues like not noticing the teacher. And sensory seeking, actively seeking input, affecting focus and stillness. Executive functioning deficits. Executive functioning encompasses cognitive skills used to complete tasks. Autistic children often face difficulties with planning, organization, impaired working memory, and reduced attention, significantly impacting their learning behaviors and ability to follow multi-step directions. Language and communication challenges. Children with autism often face language development delays, impacting their education. Delayed expressive language hinders classroom communication, making it hard to express needs and articulate concepts. Delayed receptive language affects following directions and understanding academic material. Social language difficulties can impede participation in group tasks and interactions with peers. Cognitive processing differences. Autistic children often excel in visual processing, but may struggle with verbal or written information and abstract concepts. They may have difficulty understanding figurative language and generalizing skills across different contexts. Learning style preferences. Visual learning is often effective for autistic children, especially when lessons include pictures or diagrams. They also thrive in structured environments with predictable routines. Changes such as new tasks or group activities can be challenging for them. Restrictive and repetitive behaviors. Autistic children often exhibit restrictive and repetitive behaviors, RRBs, like stimming or focused interests. These behaviors can distract them from academic learning and hinder their ability to adapt to new or unfamiliar material. Practical teaching strategies. The social, communicative, and behavioral challenges of students with ASD impact their academic success, placing them at a disadvantage in inherently social school environments. Implementing tailored strategies in mainstream and special education classrooms is essential for their positive school experience. Social strategies. Teaching social skills to students with autism is most effective in their natural settings, such as the classroom. Methods include using peer role models, engaging in playful imitation games, and leveraging technology to foster social, behavioral, academic, and communication skills. These strategies help create a supportive learning environment. Behavioral strategies. Autistic children may display disruptive behavior during transitions, affecting their learning and classmates. Effective strategies include engaging students in creating personalized transition plans, teaching coping mechanisms for anticipated stressors, and fostering independent learning programs to reduce reliance on adult support. These approaches help manage behavior and ensure smoother transitions. Academic strategies. Teachers can help students with ASD achieve academic goals by using technology for visually engaging lessons, Highlights from adapting this shared module. reading activities. This module covers down the following tasks points with clear instructions. 60 to 70% creating a of structured individuals learning with environment autism to reduce also anxiety experience and promote learning focus. Disabilities. Sensory processing significantly impacts academic performance in autistic children. Autistic children excel in visual learning, particularly with pictures or diagrams. Communicative, social, and behavioral challenges directly affect academic success in students with ASD. Computers are valuable tools for students with autism in various domains. You have now completed this module. You can study the module again and take notes where necessary. Next, we will request that you attempt the exam to check how much you have learned from this module. Welcome to the module. Autism diagnosis as a teacher will be explained here. Introduction to the module. Understanding the importance of early autism diagnosis is crucial for educators. Recognizing signs, understanding masking behaviors, and initiating the diagnosis referral process are key steps in creating a supportive environment. This module covers educators' roles in identifying concerns, facilitating referrals, and helping children understand their autism. Learning objectives. At the end of this module, you will be able to identify potential signs of autism in students, recognize masking behaviors, report concerns about autism effectively to parents and support services, learn about the autism diagnosis referral process, develop communication skills to help children understand and embrace their autism identity. Recognizing potential signs. As educators, possessing the ability to discern potential signs of autism in students is pivotal for fostering a supportive and inclusive learning environment. Autism presents itself on a spectrum, meaning that the range and severity of challenges faced by each individual can vary widely. Signs in young children with autism may include avoiding eye contact, not responding to their name, not smiling back, getting upset by certain tastes, smells, or sounds, engaging in repetitive actions like hand flapping, and using the same phrases repeatedly. They may also appear less animated than other children. Signs in older children with autism include difficulty understanding others' thoughts or feelings, trouble expressing themselves, and a preference for strict routines. They may get upset by disruptions, show intense interest in specific subjects, struggle to make friends, prefer being alone, and interpret phrases like break a leg literally. Masking autism. Recognizing autism can be challenging, especially in females who often mask their difficulties to fit in socially. Despite this, they still have the same underlying needs as other autistic children. Autism can present differently in females who mask their challenges, often showing more social interaction, a more active imagination, frequent engagement in pretend play, and interests similar to other girls due to greater social expectations. Report concerns about autism. If a teacher or authority suspects that a child may have autism, they should speak to the child's parents or carers and report their concerns. However, speaking of such a delicate issue is not an easy job. It requires empathy, respect, and a focus on positive aspects that can contribute to a supportive and constructive dialogue about the child's well-being. Choose the right person. Identify who is most suitable to discuss concerns about a child's potential autism diagnosis. Do your best to consider the person's relationship with the family and their communication style. Pick the right time. Schedule a dedicated meeting to address the topic, rather than including it in a general progress meeting. This ensures focused attention on the matter and allows for a more open discussion with the parents or carers. Be prepared with information. Have relevant articles and facts ready to share to alleviate anxieties and answer questions. This proactive approach demonstrates your commitment to providing helpful resources and may as well help the parents with a sense of reassurance. Clear communication. Use clear and concise language, considering the pace that suits the individual. Encourage questions and be attentive to the person's reactions, fostering a two-way conversation. Consider written communication. Consider writing a letter or an email if you think it may be a more suitable approach. This gives both parties time to process the information and can be particularly helpful for those unfamiliar with autism. You can also include resources and offer availability for further discussion to support understanding. Emphasize strengths. While preparing for various reactions is essential, try not to dwell on the negatives. Focus on positive aspects, emphasizing the potential benefits of a formal diagnosis and the ability to provide accurate support for the child's strengths and needs. Highlight success stories of individuals with autism to inspire hope and confidence. Autism diagnosis referral process. Obtaining an autism diagnosis for a child in your school can greatly assist staff in providing better support, help parents understand their child's needs, and allow the child to connect with autistic peers. Even if parents are unsure, suggesting a referral can prevent delays in the process. Initiating the process of autism diagnosis. The GP or health visitor for younger children should be consulted by parents. Parents ought to bring a list of behaviors and characteristics that lead them to believe their child may have autism. As the teacher guiding them on the issue, you could advise them to keep a behavior diary leading up to any appointments after the referral. Screening. The child's GP or health visitor may conduct a screening interview known as an MCHAT, modified checklist for autism in toddlers, if the child is preschool age. This can help determine whether a child may have autism, but it won't diagnose them. Referral for formal diagnosis. Once the child's challenges are acknowledged by the GP or health visitor, a formal assessment diagnosis is recommended. There may be a waiting period before the actual assessment. During this time, parents can explore referrals to other support teams, such as speech and language therapy, occupational therapy, or education support services. Private assessments. If parents can afford it, a private diagnosis can reduce wait times. Costs and services vary, so parents should inquire. However, some local authorities might not accept private diagnoses, so staying on the NHS waiting list is advisable. Helping kids understand their autism. Explaining an autism diagnosis to children is challenging but essential. As a teacher, you play a crucial role in this education, using available resources to support your students' learning and success. Explain autism to students using age-appropriate, simple terms and specific behaviors rather than general examples. Keep the information concise and be prepared for ongoing discussions, stopping if the student loses interest. Highlight to your students how having autism can be unique and special, focusing on their strengths and how these can help them succeed. Be prepared to answer questions, provide comfort, and assure them that a diagnosis does not define their worth. Avoid using autism as an excuse for challenges. Highlights from this module. Educators must skillfully recognize signs of autism to create a supportive and inclusive learning environment. Some children, particularly females with autism, can mask certain difficulties, making diagnosis challenging. If a teacher suspects a child may have autism, they should talk to the parents or carers and report their concerns. Autism diagnosis aids educators in supporting children and helps parents understand their children's needs. Teachers can empower students by communicating with them and helping them understand their autism diagnosis. That's the end of this module. Please check the resource section to learn more about autism diagnosis, such as the diagnosis of adults, male and female, as well as about diagnosis instruments. Keep on reading and practicing, and we'll see you in the next one. Welcome to the module. Let's learn about cognitive approaches to autism. Introduction to the module. Inclusive education requires teachers to understand autism deeply and adapt their teaching methods. This module equips educators with insights into cognitive aspects and recognized approaches like the SPELL framework, teach approach, and person-centered approach, helping them create supportive learning environments for autistic students and collaborate effectively with parents. Learning objectives. At the end of this module, you will be able to Understand the cognitive aspects linked to Autism Spectrum Disorder, ASD. Navigate the SPELL framework and the TEACH approach for effective support of ASD students. Utilize the person-centered approach to tailor support for ASD learners. Survey diverse recognized approaches to enhance support for neurodivergent students. Implement practical strategies for fostering social inclusion in classrooms for students with ASD. Cognitive aspects. Cognitive aspects refer to the mental processes and abilities associated with acquiring, processing, storing, and using information. In the context of autism, examining cognitive aspects may involve assessing how individuals with certain conditions perceive and process information, as well as understanding their strengths and challenges in various cognitive domains. As a teacher, to understand the cognitive aspects of autism, you should study the following two theories: mind blindness theory, empathizing systemizing theory. Mind blindness theory. One theory related to autism is that people with the condition experience mind blindness, whereby they are not aware of the thoughts of other people. Mind blindness means they do not experience feelings of empathy in the same way that those without autism do. This lack of empathizing ability could explain why children with autism struggle when socializing or trying to communicate. Empathizing systemizing theory. The empathizing systemizing theory of autism states that alongside a lack of empathy, individuals on the spectrum have at least at level, if not superior, system skills, which may explain their tendency to focus heavily on an area of interest to them and why they engage in repetitive behavior patterns. Several autism theories also predict that individuals with autism have excellent attention to detail. Recognized approaches to autism. Over the years, various approaches and interventions have been recognized to support individuals with autism. These approaches aim to enhance their quality of life, improve communication skills, and foster social interactions. Some of the recognized approaches to autism include SPELL framework, TEACH approach, person-centered approach. The SPELL framework. The SPELL framework helps to pinpoint the specific issues facing the individual with autism and then create a plan to reduce their negative impacts. It is valid for individuals at all points on the autism spectrum. The framework focuses on the needs of each person with autism as an individual and how best to meet them. Inclusive education requires teachers to understand autism deeply and adapt their teaching methods. This module equips educators with insights into cognitive aspects and recognized approaches like the SPELL framework, TEACH approach, and person-centered approach, helping them create supportive learning environments for autistic students and collaborate effectively with parents. TEACH approach. The TEACH approach is an effective framework for supporting individuals with autism, focusing on 5 key areas: teaching professionals to better understand autism, expanding knowledge to provide improved support, appreciating the positives of those with autism, collaborating and cooperating with all involved in their care, and taking a holistic view of their life and community. Person-centered approach. A person-centered approach places the individual's needs at the core of care planning, recognizing their interests and abilities. It involves 5 key aspects: centering on the person's needs, involving family and friends in planning, tailoring support to the individual, ensuring community involvement, and updating the plan as needs change. Other recognized approaches. Every individual with autism is unique, and interventions should be tailored to their specific needs and strengths. A multidisciplinary approach that combines different strategies often provides the most comprehensive support for individuals with autism spectrum disorder. That's why, as a teacher, you should have at least a minimal knowledge of other recognized approaches to autism. SCERTS, the Social Communication, Emotional Regulation and Transactional Support Program, assists with the challenges faced by those with autism, such as communication, relationship building, emotions and stress. It sets achievable tasks for each area that enables the individual to make progress towards specific goals. Applied behavior analysis, by emphasizing systematic observation and data-driven decision-making, applied behavior analysis (ABA) tailors interventions to reinforce desired behaviors while minimizing undesirable ones. This evidence-based approach not only fosters skill acquisition, but also strives to enhance the overall quality of life for individuals through targeted behavioral interventions. Positive behavior support. This is an approach that can help individuals to deal with the negative behaviors associated with autism. It focuses on understanding the root causes of challenging behaviors and implementing proactive strategies for fostering positive alternatives. By promoting a supportive environment and addressing underlying needs, positive behavior support aims to enhance the overall well-being and quality of life for individuals with autism. Sensory diets. Sensory diets involve a daily plan that incorporates specific activities that require the individual to act on the information provided by their senses. These activities aim to regulate and enhance sensory processing, promoting a more balanced and comfortable experience for individuals with autism. By incorporating tailored sensory inputs, sensory diets contribute to improved self-regulation and overall well-being. Alternative therapy. There are some alternative therapy ideas that often help in managing autism. Alternative therapies include yoga, art therapy, cognitive behavior therapy, music therapy. Preparing for social inclusion. It can be challenging for individuals who have autism to develop relationships with others, and specific methods of support can prepare them for situations where they need to socialize with others. That's why teachers need to be prepared to take measures to socially include students with autism. Inclusive social measures. Role-playing provides a safe environment for people with autism to practice and test things out. Tasks can appeal to individuals who feel more comfortable with a restrictive routine. Empathetic buddy. An empathetic buddy can be a significant help to an individual with autism in a particularly challenging social situation. Time alone. Individuals with autism should also have time alone to recharge and focus on their interests. Highlights from the module. This module covers the following points. Individuals with autism have different cognitive experiences than people without autism. They may experience a mind blindness, a lack of empathy, and feel more comfortable with systems and routines. There are numerous frameworks and therapies for autism, such as the SPELL framework, TEACH, and SCERTS. A person-centered approach is one in which the needs of the individual are at the heart of all care planning. It can be challenging for individuals with autism to develop relationships with others, and specific methods of support can prepare them for social situations. Individuals with autism should also have time alone to recharge and focus on their interests. You have now completed this module. You can study the module again and take notes where necessary. Next, we will request that you attempt the exam to check how much you have learned from this module. Welcome to the module. This module is about dealing with the students who have autism. Introduction to the module. In an inclusive educational setting, understanding and addressing autistic students' needs is crucial. This module provides educators with knowledge on behavior patterns, causes of unlawful behavior, autism equality, and legal obligations, empowering them to create a supportive learning environment for all students. Learning objectives. At the end of this module, you will be able to manage behavior patterns in students with autism, Address causes of unlawful behavior in students with autism. Implement Equality Act adjustments in education. Support pupils with autism during examinations. Comply with legal obligations for students with autism. Behavior patterns. Behavior patterns generally exist as a means of coping or attempting to communicate with others. The world can be a complicated place for individuals, especially students with ASD, and they often do not understand the rules and social norms. Behavior origins. Behaviors can be driven by sheer frustration, fear, being tired or angry. Behaviors that you may see include repetition and routine, fixation on a particular topic, highly sensitive or not sensitive at all, to stimuli, specific fixations with eating or the color of their clothes, potentially harmful behaviors. Some behaviors have the potential to be harmful, such as eating non-edible items known as pica, hair pulling. In some cases, they get pleasure from their behavior patterns. In other cases, it helps to reduce their feelings of stress. Teachers must help manage students' behavioral challenges by understanding the motivations behind the behaviors, taking action if harmful, providing routine to reduce stress, setting limits and rewarding positive behaviors, and using students' areas of focus as a distraction from negative behaviors. Unlawful behavior in autistic students refers to actions that violate laws or societal norms. Common factors include misunderstanding social cues, fixations leading to theft, inability to read others, difficulty with unexpected events causing aggression, lack of understanding of their behavior's implications, and behaviors being a cry for help in coping. Autism equality. The Equality Act 2010 states that a student has a disability if a physical or mental impairment substantially affects their ability to perform daily activities. Autism, a lifelong condition affecting perception and interaction, is included under mental impairments. Most autistic individuals fit this description, even without a formal diagnosis. Equality Act coverage. To learn how to properly deal with students with autism, teachers and school administrators must be knowledgeable of the factors that are covered by the Equality Act. For instance, a school must not discriminate against an autistic student in relation to the following: admissions, how education is provided, exclusion, any other disadvantage or denial of opportunity or choice. Aspects of educational provision. The Equality Act ensures that education for autistic students covers all school activities and facilities, including extracurricular activities, after-school clubs, sports, trips, behavior management, libraries, IT, and assessments. Reasonable adjustments. Reasonable adjustments are modifications schools must implement to help disabled pupils, including those with autism, access education and facilities. These can include modified uniforms, adjusted lesson times, support during events, quiet areas, and coordinated inclusion in school trips. Support for autistic pupils in examination. Just as schools have a responsibility towards their autistic and other disabled students for internal exams, it's also unlawful for general qualification bodies, EGQBs, to discriminate against pupils taking formal examinations. Autistic students can be supported with exams in various ways, such as additional time, having someone write for them, assistive technology. Legal obligations to adhere to at all times. When teaching students with autism, adhering to ethical and legal practices is essential. Schools must provide appropriate support and training, ensure specific adjustments like quiet spaces and extra time, and offer suitable school placements, whether specialist or mainstream, to meet the child's needs. Highlights from the module. This module covers the following points. Behavior patterns generally exist as a means of coping or attempting to communicate with others. Unlawful behavior in autistic students refers to actions or activities that violate established laws, rules, or societal norms. Mental impairments include autism, a lifelong disability that affects how people perceive the world and interact with others. Reasonable adjustments are mandatory modifications, ensuring disabled pupils can fully engage in education and access school facilities. When teaching students who have autism, it is essential to adhere to ethical and legal practices. You have now completed this module. You can study the module again and take notes where necessary. Next, we will request that you attempt the exam to check how much you have learned from this module. Hi, and welcome to the module. It is about autism-friendly approach in classroom environments. Let's get started. Introduction to the module. Creating an autism-friendly classroom is essential for inclusive education. This module covers environmental inclusivity, teacher insights, collaboration with parents, and ongoing self-education to enhance learning for autistic students. Embracing these strategies fosters a compassionate and inclusive educational environment. Learning objectives. At the end of this module, you will be able to adapt classroom environments for inclusivity, learn from past instructors to enhance teaching practices, foster an inclusive classroom dynamic, collaborate effectively with parents of autistic students, emphasize continuous self-education for informed teaching. Environmental inclusivity. Creating an autism-friendly classroom environment involves collaboration among educators, students, parents, and the school community. The first step is ensuring environmental inclusivity, which means designing classrooms that accommodate and support the diverse needs of students with autism. This approach fosters a sense of belonging, comfort, and accessibility for all learners. Optimized classroom setup. Design an autism-friendly classroom by optimizing the physical layout for smooth transitions, arranging furniture to support different instructional formats, and clearly labeling workstations and cabinets. Use furniture and colored tape to create distinct boundaries and specific areas. Declutter. Classrooms often accumulate unused items that can distract students, especially those with autism. Educators should periodically declutter to create a purposeful learning environment by removing unnecessary items to improve focus and enhance the learning space. Visual autonomy. Use visuals to enhance comprehension, such as labeling cabinets with words or images and employing a visual schedule for the daily flow. Establish boundaries for personal space with masking tape for students who struggle with spatial awareness. Designated calm-down area. Misunderstandings and communication breakdowns can cause frustration and meltdowns in students with autism. A designated calm-down area with soothing items, like a desk with dividers or a corner with a beanbag chair, can help. After calming down, teach stress reduction techniques in this space, but never use it as punishment. Resource optimization. Organizing the classroom is essential when teaching students with autism. A well-structured environment minimizes distractions and caters to individual needs. Efficiently arrange desks, store personal items, and organize teaching materials, using shared storage and accessible data collection methods, such as wall-mounted clipboards or labeled file folders. Sensory stimulation. Autistic students often face sensory challenges, so try to minimize sensory stimuli whenever feasible. Take note of factors such as lighting, windows, floor coverings, and ceilings. Simple adjustments like lowering shades and reducing overhead lights can prove beneficial. Utilize carpets to diminish noise levels and orient desks away from windows or doors. Gleaning insights from past instructors. Gleaning insights from past instructors is valuable for creating an autism-friendly classroom. Reviewing previous lesson plans and communication strategies helps identify successful practices and areas for improvement. Collaboration among educators, parents, and support staff ensures a consistent and inclusive environment. Implementing the insights. Implementing a thoughtful approach to welcome students with autism back to the classroom involves strategic planning. Create a welcome booklet with staff photos and a first day outline and send it home with a note. Highlight positive aspects from the previous teacher's notes to boost the student's confidence. Prepare a personalized welcome kit based on previous teacher's notes, including favorite toys and items for a thoughtful first day back. Understand the child's sensory profile, ensuring headphones and a wobble cushion are accessible. Maintain visual continuity by using familiar visual aids from the previous class. Inclusive classroom dynamic. Inclusive classroom dynamics, especially when adopting an autism-friendly approach, go beyond mere accommodation. They emphasize understanding, acceptance, and collaboration. Creating a supportive environment not only benefits students with autism, but also enriches the overall educational experience for every student, fostering a sense of community and empathy within the classroom. Peer interactions. Establish activities like a games group, playtime buddy system, or partner work in class to encourage positive interactions between the child with autism and their peers. Foster an inclusive environment that nurtures social bonds. Visual support. Increase the child's engagement in classroom routines with visual aids like schedules and positive narratives, making it easier for them to refer to and remember instructions. Empower the child's sense of independence and confidence in navigating daily activities. Inclusive lesson plan for the autistic child's involvement in class lessons by providing tools such as a whiteboard, visuals, a personal storybook, a fiddle toy, or assistance from a teaching assistant. Collaborate with the TA to ensure effective implementation, promoting a personalized and supportive learning experience. Collaborative teaching. Allocate dedicated time in your schedule to personally teach the child, establishing a collaborative approach with the teaching assistant for comprehensive understanding and support. Cultivate a learning environment where both you and the TA are actively engaged in the child's educational journey. Collaboration with parents. By involving parents in the education of students with autism, educators can create a more holistic learning environment. Start by learning parents' first names and meeting with them early to understand their hopes for their child. Use a homeschool diary for regular updates, fostering a supportive and inclusive learning environment. Self-education as a teacher. Self-education empowers teachers to create an inclusive classroom environment. Seek guidance early, collaborate with teaching assistants, and build relationships with professionals for valuable insights. Educate yourself about autism while recognizing individual differences, and maintain a positive and calm approach to understand students' behaviors effectively. Build relationships with professionals to gain valuable insights and support. Educate yourself about autism while understanding that each child is unique with their own strengths and challenges. Maintain positivity and calmness to better interpret the child's communication. Highlights from the module. This module covers the following points. Environmental inclusivity involves creating an educational setting that accommodates and supports the diverse needs of students with autism. Conversations with former educators provide valuable information on effective accommodations and personalized learning techniques. Inclusive classroom dynamics extend beyond accommodation, focusing on understanding, acceptance, and collaboration. By involving parents collaboratively in the education of students with autism, educators create a more effective learning environment. Self-education empowers teachers with the tools to cultivate an inclusive and understanding classroom. You have now completed this module. You can study the module again and take notes where necessary. Next, we will request that you attempt the exam to check how much you have learned from this module.